Good morning, good afternoon, and good evening. I want to welcome you to this digital dialogue on children in alternative care. My name is Sabine Rakotomalala, and I work for the World Health Organization. As you may know, in November 2024, we had the first ministerial conference on ending violence against children. We had over 1,500 participants, children, young people, survivors, heads of UN agencies, donors, and very importantly, over 110 governments that made over 370 pledges and pledges on all topics. And one of these topics was children in alternative care. When we speak of children in alternative care, we speak of children in prisons, children in care settings, basically children that are not receiving the family support that they would actually need. We look forward to this session. It's the first of a series. It's the first on this topic through the WHO. It's the second one of a series of 8 of the digital dialogue. We're holding the digital dialogues every Wednesday throughout the months of July, August, and September, also in preparation for the next ministerial conference, which we hope will take place end of 2026. I just want to, before handing over to Howard, who will be moderating the session from the Lumos Foundation, I just want to make you all alert to the fact that there's interpretation into Ukrainian and Spanish and back, and there's the option of captioning. And with that, I will hand over to Howard. Thank you, Howard.
Fantastic. Thank you, Sabine. Hi, everyone. Good morning, good afternoon, good evening. Wherever you are in the world, it's good to see so many people have joined and still joining, but let's get going. We know that violence against children and children's care intersect in several ways. First, violence plays a significant role as a driver of family separation and placement of children in alternative care. Second, we know that children and young people who enter the care system are exposed to the risk of further violence in a system that's actually meant to protect them. So child institutionalization is inherently harmful to children. The effect both on children's rights and development is well documented, but it's also recognized as a form of violence against children itself. And the good news is that there is a win-win to be had. We know that well-supported, resilient families in which children can grow in love and safety and security are both the cornerstone to end violence against children and in the prevention of unnecessary child-family separation. So it's also vital to ensure that child protection and care systems only place children in alternative care where necessary, and that safe family-based alternative care options are provided for all children, and thereby helping to eliminate the cycle of violence perpetuated by institutionalization of children. So all of that said, is integrated efforts to end violence, to reform care systems are crucial to each other's success. And at the Ministerial Conference to End Violence Against Children last November in Bogotá, Colombia, several countries made pledges linking the reform of child protection and care systems to strengthening families and providing family-based alternative care, recognizing that that they're all intrinsic components of ending violence against children. And I'm excited to share that today we're going to hear from some of those countries about the progress they have made so far in implementing the pledges in Bogotá. We're also going to hear later from a selection of national, regional, and global experts who will draw out some of the critical issues that we see at the interface of tackling both violence against children and reforming care system. And we want this to be conversational. We hope this will be an insightful exchange for everyone on the call. We won't, I'm sure, have time to answer all questions that are raised, but do please use the chat function. We'll be keeping an eye on it. We'll look out for key questions, key themes emerging, and do our best to address it during the course of the next 90 minutes or after the conclusion of today's session. And finally, before we get going and hear from our first speaker, just to say that our safeguarding focal point for this session is Lucy Halton from Lumos Foundation, one of my colleagues. Please do, if you have any safeguarding concerns, questions, etc., send her a private message in the chat during the session. That's Lucy Halton from Lumos Foundation. So, with all that intro done, let's get going. And in the first part of this digital dialogue, we're going to be hearing from national governments about the implementation, as I said, of the pledges they made at the Ministerial Conference in Bogotá, Colombia last November, looking at that interface between violence against children and care reform. I'm going to invite 4 speakers each to make short remarks, and then there'll be a conversation among the speakers, bringing out the points of similarity and difference, of opportunity and challenge in implementing those pledges. So we are just changing the running order in real time, because I'm not sure our first speaker has managed to join yet. So our first speaker today will now be the Honourable Rowena Macalinta, who is Assistant Secretary for Operations and Services in the National Authority for Childcare in the Government of the Philippines. So good evening, Rowena. If you could please speak to the question of what steps have what has the Government of the Philippines done since the Ministerial Conference to implement the pledge and address ending violence against children and reforming childcare protection system in an integrated fashion.
Yes, Howard. A pleasant evening, mapag-arugang gabi from the Philippines to all our hosts from the WHO, UNICEF, Better Care Network, and Lumos. At the Global Ministerial Conference in Bogotá, the Philippines made a bold commitment to transform the care system by shifting toward family-based care and promoting deinstitutionalization through family integration, family reunification and strengthening, and through alternative childcare systems for children without parental authority. This commitment reflects a long-standing truth that no child should grow up without a family. Allow me to share 3 highlights from the Philippines Pledge implementation journey so far. Number 1, on the strengthening of systems through national frameworks. Our care and protection commitments build on the foundation of our law, Republic Act 7610, otherwise known as the Special Protection of Children Against Abuse, Exploitation, and Discrimination of 1992, as strengthened by our 4th National Plan of Action for Children, or NPAC, for 2024 up to 2028. This serves as the current umbrella framework that consolidates national goals across survival, development, protection, or to reintegration, and participation of children. Under the NPAC, the Philippines formally endorsed the Child Protection Systems Strengthening Framework. This is under our Department of Social Welfare and Development. This DSWD-led strategy institutionalizes preventive, responsive, and reintegrated mechanisms, including the scale-up of our multidisciplinary teams nationwide. One key vehicle for localized implementation is the Makabata program, institutionalized through Executive Order Number 79, Series of 2024. The Makabata program, under the DSWD and under the Council for the Welfare of Children, provides a performance scorecard for our local government units, and it establishes 24/7 Makabata Helpline 1383 and promotes cross-agency accountability for children in need of special protection. The NACC is a committed partner, ensuring that whenever children are left without parental authority, our alternative care system will ensure that they are transitioned to permanent family care through protection, referral, and reintegration pathways. Number 2 is the NACC's actual mandate, advancing family-based alternative childcare system. Under the leadership of the NACC, we're accelerating reforms in reintegration of children without parental care or at risk of losing it through domestic administrative adoption, intercountry adoption, kinship care, and foster care. Through RA 11642 enacted in 2022, the Philippine judicial adoption shifted towards administrative adoption, thereby making adoption simpler, streamlined, inexpensive, and expeditious. We have scaled up our foster care system by targeting the development of at least 10 licensed foster parents per local government units, backed by monthly financial subsidy from the NACC to support the provisions of care for our foster children. These reforms don't just address care, they prevent violence, instability, and hopefully address the cycle of trauma for the child. Last but not the least, interagency enablers, mobilizing resources, empowering children, and addressing OSAIC-CSAIM under our One Nation Whole of Government approach. On budget allocation, the Philippines has pledged to allocate at least 3% from the 1% national local government funds to child protection. LGUs, or local government units, are now measured through a unified scorecard that tracks their commitment to child safety, budgeting, and participation. On child participation, we are institutionalizing the meaningful participation of children especially survivors, in designing and monitoring child-related policies and programs. We want to ensure that children are consulted and heard. Our local government units are now required to report how they involve children in their local development plans under the Makabata indicators. And the National Coordinating Center, or OSAIC-CSAIM, under our Department of Justice, leads the implementation of our anti-OSAIC law, ensuring that children in care are protected from online abuse and included in survivor reintegration programs. Our journey is far from over, but each child restored to family, each community empowered to protect, and each system reformed to heal is a step closer to ending violence. Our reform journey is not perfect, but it is purposeful. We are shifting from a system that asks, where do we place children, to one that now asks, how do we support families and systems so separation is the last resort? We are building a national care system where no child is invisible, not by poverty, not by violence, not by policy failure. And we look forward to learning, adapting, and fulfilling our shared global pledge together. Maraming salamat po. Thank you very much at mabuhay po.
Rowena, thank you. First of all, big thank you and respect for all that you and colleagues across the government of Philippines and partners are doing. That was extraordinary. I love that end bit there around that you're shifting from where to place children for how best to support families. And you spoke very fast and you were well within the time. And so I was trying to capture some of the main points you made, but there were so many in there about the multidisciplinary teams, around the importance of budget allocation, of child participation. And I think, the honesty as well, that every country recognizing this is a journey. And you said it's not perfect, you're on a journey, and you have a clear direction and a plan of action and implementing that to get there. So thank you so much for sharing all that's going on in the Philippines. We'll go next to Ghana. So if I can invite Dr. Prince Abra, who is the National Director of Social Welfare in the Department of Social Welfare within the Ministry of Gender, Children and Social Protection from the Government of Ghana, to respond to the same question about what steps the Government of Ghana has taken since the Ministerial Conference to End Violence Against Children to address the pledge made on tackling violence against children and reforming care and protection in Ghana.
Thank you very much. All right, so I'm Dr. Prince Abra from Ghana. So distinguished colleagues and partners, warm greetings from Ghana. I'd like to express my sincere gratitude to WHO, UNICEF, Better Care Network, and Lumos for the kind invitation to participate in this forum. Ghana is honored to be part of this critical conversation, having made a commitment in Bogotá to prevent and respond to violence against children in all settings, including the care system. As a nation, ending violence against children is a priority, one that is firmly embedded in our national development plans, legal frameworks, and policies. However, violence against children remains a pervasive challenge for many children in Ghana. According to the Multiple Indicator Cluster Survey that was conducted in 2017 and 18, 94% of children aged 1 to 14 years have experienced some form of violence in discipline. In the context of care reform, a nationwide survey conducted by the Ghana Statistical Service and the Department of Social Welfare with support from UNICEF in 2019 showed a troubling reality. The study shows that out of 3,000 children living in residential care, more than half were exposed to violent forms of discipline, ranging from physical punishment to psychological aggression. As a country, this is not the kind of childhood we aspire for Ghana's children. In response to these troubling realities, we have taken key steps to reform the care system and also to prevent violence. Presently, Ghana is implementing a national care reform roadmap aimed at strengthening families, promoting family-based alternative care, and ensuring reintegration of children with families. Ghana is honored to be part of this conversation, having made a commitment in Bogotá to prevent and respond to violence against children in all settings, including the care system. As a nation, ending violence against children is a top priority, one that is firmly embedded in our national development plans, our legal frameworks, and our policies. However, violence remains a pervasive challenge for many children in Ghana. According to the multiple indicator cluster survey that was conducted in 2017 and 18, 94% of children aged 1 to 14 years have experienced some form of violent discipline. Within the context of care reform, a nationwide survey was conducted by the Ghana Statistical Service and the Department of Social Welfare with support from UNICEF in 2019. And this study showed a troubling reality regarding the number of children in institutions. The study shows that out of 3,000 children living in residential care, more than half were exposed to violent forms of discipline, ranging from physical punishment to psychological aggression. And as a country, this is not the kind of childhood we aspire to for Ghanaian children. So in response to these issues, the government has taken several steps to reform the care system and also to prevent violence. Presently, as a nation, Ghana is implementing a national care reform roadmap aimed at strengthening families, promoting family-based alternative care, and ensuring the reintegration of children with their families. Since the study, the number of children in the residential home has reduced drastically from 3,500 to 3,122. And also, we have also seen a reduction in the number of institutions as well. We are also rolling out a new feature called registry in the primary based social welfare system. With the social welfare management information system, we have a system that we are introducing a new feature to it. And the abbreviation for this case management system is called the SWIMS. So we call it SWIMS in Ghana. So this system is currently active in 180 districts in Ghana. And so with the introduction of the registry, we are expected to register cases of all children in our residential home and also make follow-ups on any report of violence through our digital case management systems. Also, with support from UNICEF, we are conducting monitoring visits to regions with high concentration of residential care homes, guided by our national inspection tools. We have an SOP, so we're going to use that to do some monitoring exercise with support from UNICEF. And so this exercise aims to ensure safety, protection, and overall well-being of our children residing in these institutions. Also, we are also investing in the social service workforce by providing pre- and in-service training for district social welfare officers to improve frontline response, family support, and gatekeeping functions. This year, we are going to develop a 5-year capacity building strategy for social workers based on evidence and the need and wishes of social workers, especially those engaged in care reform. So finally, what we intend doing this year, next week, is that all 16 regions in Ghana will be sensitized on the Bogotá Pledge and the Child Protection Systems Strengthening Framework of Action signed by our minister. With this, we intend to ensure that local authorities understand their roles and responsibilities in addressing violence against children in every setting and also prepare for annual reporting. We welcome this space for cross-country learning and collaboration. And Ghana believes that by sharing experiences, lessons, and holding ourselves accountable to the pledge made in Bogotá, we can create a future where all children are safe, supported, and able to thrive in loving family environment. Thank you very much.
Prince, thank you so much. Thank you so much for that inspiring remarks from Ghana and a sense of what the progress being made there. And I think some of the points you pulled out in your remarks were the importance of having not just a plan, but also the legal frameworks in place and the policies that then become implemented. And I picked up also what you said towards the end about the importance of local authorities also being involved, which is really important in this agenda. It doesn't just need the national government leadership, it needs also governance at all levels, including local authorities. So thank you for those remarks, and thank you for sharing the progress that's being made in Ghana. So we're going to go now to David Bailey from the UK government, who is head of the Children's Care Reform Campaign. at the UK Foreign, Commonwealth and Development Office. And that title of where David sits in the UK government probably gives you a little bit of a sense of what he's going to talk about, which is the Children's Care Reform campaign that is being led and driven by the UK Foreign Secretary, David Lammy. David Bailey, over to you.
Thanks, Howard. Well, it's good afternoon for me, so I'm say good afternoon wherever you are. So yes, I'm a representative of the Foreign, Commonwealth and Development Office here in the UK, working on the Foreign Secretary's campaign to reform children's care globally. I did want to just touch on some of the wider work that the UK is doing and has been involved in since the Bogotá conference in November, because we had a number of pledges, including around this the care campaign, which I'll come on to talk about. But one of the important pledges was also around violence in and around schools, which I think we've heard a little bit about already. And in May, Lord Collins and Minister Saki, the Minister for Education, and the Minister for Education for Sierra Leone, co-chaired the inaugural meeting of the Ministerial Task Force on this particular issue with 11 other countries. So there's some good progress there. And we've also started now partnering with Girls Not Brides and Girls First Fund to push forward progress on addressing child early and forced marriage. So all really important issues. But the main pledge that is relevant to the work that I do and why I'm here really is that we pledge to champion the importance of strengthening families and child protection systems to secure safe and nurturing environments for children. And obviously, this is critical. We've heard encouraging stories already from those who've already spoken about the progress that's being made around the world. But it's clear that this is an issue that has not had the exposure that it probably needs and deserves. And most of us on the call will be aware of the numbers of children, the millions of children that are in institutional care, and the numbers of children that are growing up in unsafe environments that won't be nurturing and will lead to, as we know, delays in cognitive and physical development, and the impacts of which will last into later life and into adulthood. So firstly, I did want to address some of the progress that we're making in the UK, because this is a global issue. There is no country that has solved all of these issues or doesn't need to kind of make progress. And in November, the UK government published a policy paper, Keeping Children Safe, Helping Families Thrive is the title. And the ambition is to really reset the children's social care system with 4 key reform principles, which are that children should remain with families and be safely prevented from entering alternative care wherever possible. That where children cannot remain at home, that they should be supported to live within kinship care or foster families rather than any form of residential care. And also that we are looking to fix what's described as a broken care market, where there are exploitative practices in place, and so we're looking to take steps to address that, and then investing in the key enablers which underpin the children's social care system. So that's workforce, data, information sharing, and the spread and scale and use of evidence-based programs that have improved children's outcomes. So that's what we're doing in the UK to get our own house in order. But we're also very aware, and the Foreign Secretary himself is very aware, that this is a global issue. And so he has made a personal priority to lead a global effort to tackle and to reform children's care. And that campaign was launched in January. Launched in Bulgaria in partnership with the government of Bulgaria, and alongside a number of other countries who were early signatories or early campaigners alongside the Foreign Secretary, and formed a group of countries with whom we've consulted over the last few months as we've developed a global charter on children's care reform. And I can say publicly, I think probably for the first time, that global charter has now been finalised, and we are very soon going to be sharing it across our network of people working overseas and with governments globally, and encouraging governments and organisations to both sign and endorse the charter. And it calls on world leaders to act together to firstly strengthen support to families, to prevent unnecessary separation, and ensure safe and nurturing family-based alternative care, and progressively end the use of institutions for caring for children. It calls on leaders to invest in the key enablers, and I've already mentioned things like data, evidence, and the workforce to support improved services for children and families. And also to call out and tackle harmful practices, including ending violence against children, taking action to eliminate the exploitative orphanage industry and end volunteer tourism, and such other practices. In addition to endorsing the key principles of the Charter, the signatories will be encouraged in a similar way to what we're talking about now in terms of the Violence Against Children conference, to make pledges in support of the campaign. And there will be technical assistance to support the development and implementation of those commitments. So the Charter will call on leaders to work together. And in developing it, we've worked with academics, civil society, UN bodies, care experienced individuals, as well as some of the countries that have joined with the Foreign Secretary in the early stages of the campaign. We're very aware that international cooperation and partnership is crucial to tackling this issue. And many countries have already made huge strides in reforming children's care. And we've heard some of those stories already today, and I'm sure there are many more on the line. There are loads of lessons to learn and good practices to share, but there is a lack of global attention on this issue. And I think working together as governments, as organisations representing some of the most vulnerable and marginalised children, that we can give it the platform it deserves and transform the lives of some really at-risk and vulnerable children. So I'm going to close there just to say that the Charter will be being shared, and we will be calling on and asking governments to sign. We'll be calling on organisations to endorse. We will be asking people to think through and to make commitments and pledges towards reform of childcare in their own countries. And we hope to be launching in a very public way in the not too distant future. So please do watch this space. Thanks, Howard. Back to you.
David, thank you so much for that. Fantastic. And thanks also for speaking to some of what's going on in the UK domestically, as well as that exciting international component. I believe the Charter being championed by the UK Foreign Secretary is a first of its kind. Certainly it's the first of its kind that I can recall in any recent decade. And exciting to have that opportunity of a vehicle both to galvanize, continue to galvanize political attention and action against the care reform agenda. And so we'll take you on your word of watching out for what comes up next, and the opportunity to see the Charter, to sign on. And it sounds like a good agenda for action. So really exciting to know that's coming. Now, I believe that we do have someone from Kenya has joined us. I believe it is Mwambe Mungeri, who is the Deputy Director for Children's Services and the Head of Child Protection. If you are on and can hear me, please unmute your microphone. And the question to which other government representatives have been responding is what progress is being made and has been made, in this case in Kenya, since the pledge made by the government of Kenya at the Bogotá End Violence Against Children conference. What progress has been made against the pledge to tackle both ending violence against children, and as part of that, reform of child protection and care reform. So Mwambe Mungeri, if you are on and can hear me, I will pause for a moment. If you want to take your put your microphone on, The floor is yours.
Thanks. Good. I don't know what it's afternoon or morning. I'm sorry I've been struggling to come in. Kenya as a country, I'm representing my principal secretary, who is headed up elsewhere. Since we left Bogotá, that was last year, November, as a country, we have made a lot of progress on the pledges which we made. And some of what we have been able to do on the issue of family. Well, I can start on what we have already started. We had promised that the issue of alternative care, we have already come up with a concept paper to our national treasury. It has been accepted. We have developed the regulations on the same fund, because there's some funds which we need so that we assist those families offering alternative care. And so far, we have been promised we a seed capital that if the regulations go on, already the first seed capital will be around 2 billion Kenya shillings. That's the much we have been able to do. And again, since we left Bogotá, we have been working closely with the civil society organizations. When we were in Bogotá, we were working closely with Lumos International, which was in one of our counties, Kenya's 47 counties. But after we left Bogotá, there's another civil society called ICSSP came on board, and it's already covering 6 counties. So at least you can say there's a lot of work going on this of parenting and the caregiving support. From the side of government, we are still moving on. And even today, we had a meeting with our head of public service, who is the head of the civil service in Kenya. And there's a lot of things, because we raise all of these issues, and they are promised that they will be supporting us as a state department. And you have heard saying as a state department, when we were in Bogotá, we were in a different ministry. That was the Ministry of Rape and Social Protection, in the State Department of Social Protection and Senior Citizen Affairs. But in the month of April, our President, His Excellency, created a new state department specifically for this called State Department for Children Services, ARON. Now in Kenya, when we hear saying about the State Department, we have our own principal secretary dealing with children issues. And we were moved from that former Ministry of Rape and Social Protection, and now we are placed under the Ministry of Gender, Culture, and Children Services. I think that is a plus for us, so there's a lot of developments going on. That's what I can say for now, for the few moments, because that's what we have been able to do. On the issue of numbers, a lot of things are happening. Even on the committees, we have formed the committees at the county levels who are handling the issue, which is a subcommittee to children, the county advisory committees, which is handling all issues concerning about the pledges we made in Bogotá. More so on the one of parental, that was our first pledge, parent and the caregiver support. So those committees in the 7 counties, and we are still geared to move to more counties. And when we get these resources, we are seeking from our national treasury as a city capital. I know, so we seek for more support from other development partners, so that we make sure things are moving in the right direction. So far, key achievements. I've talked about what we have been able to do, establishing the county sub-county committees, and we have done MOUs with the county government, because most of the activities are done within the county government. And now key achievements, as I'm talking now, we have managed to reach around 60,000 households reached. And we have managed to establish, we have managed the issue of inclusivity and gender sensitivity. We have a program called UNICEF. We have made sure that we don't leave anybody behind. That's the vulnerable families, children with disabilities and special needs, and all other children also that who form the vulnerable and marginalized groups. And by embedding positive parenting into our multi-sectoral platforms, and the Minister of Health and Education, and the judiciary, the justice system in Kenya, we are still advancing the Bogotá commitments through systematic scale-up and inclusive interventions that prioritize the well-being of children and families within our republic called Kenya. I think that's the magic we have been able to do in a nutshell. Thanks, and over.
Thank you so much for those remarks, and really appreciate you joining us at very short notice and sharing that progress from Kenya. And among all that you said, and there's a lot in it, I had the privilege to visit Kenya earlier this year and see some of the progress being made on care reform in Embu County, and I know elsewhere in the Eastern region and now the Rift Valley. But it was interesting to also hear what you mentioned about a specific piece of government architecture that has been evolved under the president's auspices and a new department created under the auspices of the president. And again, it reinforces, I think, that, you know, the advantage, if you like, of having that high level political engagement and commitment and leadership in this agenda, as well as much more, which you mentioned. Because I also noticed you started with the reflection about some budgeting, and that came up with one of the other speakers too, the importance of, you know, going beyond policy and plan, etc. The criticality of budgeting and having these issues agendaed and budget lines for them as well is so important. Thank you for that. We're going to now take a few minutes. If all the speakers so far can be ready, if you wish to respond. There are various questions that have come through the chat. Looking at some of the questions, some of the themes emerging in the questions and comment, 2 or 3 I'm going to mention now, and if any of you then want to unmute yourselves, any of the speakers want to unmute yourselves and answer them. One is around the biggest challenge faced. What is the biggest challenge that you have faced in reducing the number of children in institutions? And if you want to broaden that, you could address the question of what's the biggest challenges you face across the agenda of tackling violence against children and care reform. Secondly, questions and commentary around the role of young people. What is the role of young people in supporting change, and even the role for young people to co-create change? Those young people with lived experience, particularly in care, what is their role in supporting, helping design and support change? And thirdly, a question which might be specific, Rowena, for the Philippines, around concerns around international adoption and whether and how those concerns are addressed. So a question around biggest challenges, a question around the role of young people, and then something maybe that's more specific to the Philippines, picking up on something that was said on international adoption. So if any of the speakers so far would like to come in and respond to any of those questions, please unmute yourself and come in, and hopefully it won't be chaos.
Can I take the floor?
Please do, please do. Come back in.
Okay. I can start the issue of international adoption as a country. As presently, we are running the issue concerning issues of adoption in our country. In the year 2013-2014 financial year, our cabinet gave a moratorium on inter-country adoption. So as we are operating now, we have people who are interested to adopt our children, but they are hindered by that moratorium. Even our Children Act of 2022, it is very clear on the chapter on adoption until that moratorium is lifted. But what we are aware, we have an individual who went to court and challenged this moratorium in 2019. And I think the judiciary ruled in his favor, but it has not been implemented. Still, the moratorium is still there. So we have challenges. We have people who are interested, but they are held by the moratorium. So it is forcing people to use other means. Like now, if you find there are those people who have dual citizens in Kenya and other countries, they come and they are doing what is this they are calling kinship adoption. I think that's a very big challenge because there is a difference between kinship adoption and inter-country adoption. So wherever those children want to leave the country to go elsewhere, they always face a lot of challenges. Although they have gone through a court process, they have been adopted. We have all of those issues. I think that we have been having that challenge. When it comes to the role of the young people in Kenya, when I spoke the issue of inclusivity. When we are talking about any issue, the issue of the family, the issue of bringing up children, caring for children, we don't leave any sector of the population out. The children through the participation, what they call it, the child participation, they have leeways where they give their views. And even though the youth affairs are in a different ministry, we work very closely. Like now, presently, we are involved with the East African Youth Parliament, where they discuss about so many issues from financing, from the issue of the family, the issue of everything. So at least the youths are informed. When it comes to the issue of ending violence against the children, there are so many issues which are still cropping up, and we are still grappling with them as a country. And even in our registration, even though the career are illegal, but you find some of the things are happening. But we can say, in essence, some of these things have gone down. Like now, we had in 2014, child marriage was at the level of it was 22, 23%. But in the latest, the Kenya Demographic Rate of Survey of 2022, it has indicated that the issue of child marriages has gone down. You know, that's one form of violence against a child when young children are married off, both boys and girls. So as a country, there's a lot of things we are doing. But the big issue, the big challenge we have, people had normalized violence against children. It was like something which was normal to them. So those are the kind of things we are grappling with in the education sector, in the communities, in the society, wherever children are. Those children who are in CCA, charitable children in institutions, or who are in institutional care, similar issues are being addressed. But what we are finding as a big challenge is now turning something people had normalized to tell them it's abnormal to stop it. I think that has been a very big challenge to our country, but at least we are very happy from the statistics we are getting and the data from our Kenya National Bureau of Statistics that some of these harmful cultural practices which were even enhancing the use of violence against children, they are going down. That's what I can report for now, over and out.
Thank you very much for that. I see Kirilo, your hand is raised. You're actually one of our next speakers, but Kirilo Nodoka, who's the head of DEMO, the Office for Children and Youth, created by the Ministry of Social Policy in Ukraine. Do come in now, but before you do, because the link went down and came back up, a lot of people's name is now simply name. So if you look at your name on the screen and it's not your name, it would really help us if you can go in and rename yourselves. And I'm sure one of colleagues will put instructions in the chat of how to rename yourself. But Kirilo, do come in, and then David.
Скажіть, я вже можу виступати, чи зараз відповіді на питання?
So I'd like to comment first about the moratorium on adoption, because we still have a Russian aggression against Ukraine. It's also forbidden here during the martial law, and a couple of months after that, adoption by foreigners and also by Ukrainians who do not live on the territory of Ukraine and who live outside of Ukraine for that time being. But that's understandable and well-founded, and we, as representatives of children and youth, support this decision, because otherwise these actions could be really harmful to children. Even though saying beautiful words about adoption could still be harmful, but the adoption within the country hasn't stopped. Actually, our citizens, regardless of complicated situation and war, they still keep adopting children, and the amount of children who were taken into the families hasn't decreased. Yes, beginning of 2022, 2023, it was a bit lower compared to the pre-war period, but now this amount has grown once again, so bounced back. So the children who were taken into the families by the Ukrainian citizens. Now about the participation of youth, we also have some attempts and some achievements here. More and more children and youth representatives who have the alternative care experience have or the violence experience, who experienced violence against them when they were children, they contribute to decision making. I will share more about this in my speech later. Thank you.
Thanks, Kirilo. Yeah, David, if you want to come in now, and then we'll move to the next set of experts. And Kirilo, I'll be coming back to you shortly. Thanks for those initial remarks, David.
Great. So I think the original question was about the challenges, particularly the challenges facing countries around kind of reform of children's care. And I think, I mean, in many ways, I'm kind of highly unqualified to really speak to that. And there'll be many people on the call who have much more experience than I do. But I think that the challenges are really varied in different countries. So I think they can range from a lack of trained foster carers, a lack of trained social workers, a lack of access to basic services, which means that it's really difficult for families or wider families or communities to take on responsibility for caring for children. In some cases, a lack of data or ability to track which children are in alternative care and what forms of alternative care those are. And I think in some countries there is a real concern that by taking a more interventionalist and more forward-leaning approach to caring for children, they will take on more of a kind of gatekeeping and safeguarding risk. I think all of those things can be barriers to reform, alongside the usual issues of kind of the funds. Now, although it's well evidenced that family-based alternative care is cheaper than institutional care, it's still the upfront costs in training and support to strengthening families and so on. There is still a cost, and in some countries the current costs of caring for children in institutions is not borne often by the government. It's often supported internationally and funded from elsewhere. So I think there's a whole range of issues, none of which I think take away from the fundamental kind of underlying evidence, which is that children are that children thrive and will succeed and are more likely to succeed. Sorry, get my words out. In family-based care, and that's the evidence is compelling and fairly unequivocal. So in terms of human capital, in terms of investment in the future, and in terms of kind of strengthening the human capital within a country, I think this is essential. As not to detract from some of the real issues that there are. What we, I think, as the UK are willing to do is to offer support through technical assistance, working with people who are much more technically savvy than I am on these issues, to really help navigate some of these common issues, and also to support shifting the debate and shifting the sense of the political will to make this happen in some countries where there will be resistance or caution. So I think I'll end there, Howard. Thank you.
David, thank you so much for that. And it's good to end with an offer of support, but also noting again that political will being so important, so vital for this agenda. I'm going to bring to a close that initial conversation, the initial remarks and responses to some of those questions from government speakers. I know that we haven't been able to address them all, but I would still encourage you, if you have comments, if you have questions, to continue to make them. They will be captured, and we will figure out a way after this event how best to respond to everyone who has joined today's event. But we're going to move on now to hear from a number of expert voices who are going to shed light, I think, on some of the and dig a bit deeper on some of the aspects the crucial aspects that exist at the interface between ending violence against children and transforming child protection and care systems. And so we're going to go first in a moment back to Kirilo from Ukraine. And I should now give you your proper introduction because you came in already, Kirilo. But you are a young man with lived experience of care, now working to transform care in Ukraine, and particularly to make sure that the voices of children, the voices of young people, particularly those with lived experience, have the opportunity to influence government policy. So back to you, Kirilo.
Greetings, thank you. Yes, it's truly so. I am here a person representing youth and youth who unfortunately knows violence not as a word from a dictionary, but as a part of a real-life experience. Today, Ukraine simultaneously faces two large-scale challenges. The first is internal violence that's been lasting for years in different forms and modes and types of care, and external violence that Russia does against Ukraine and Ukrainian children and youth publicly and openly every single day. When we're talking about the external violence, Russia is killing Ukrainian children, injuring them, abducting, depriving them of their right to life, education, health and safety, impacting their psychological and mental state. And in temporary occupied territories, Russia forces children to study following the Russian curriculum, undergo re-education, deleting their identity, being educated in loyalty to the aggressor state, and remain silent about war crimes. We also have cases of children who were prepared by the Russian Federation to go to war against Ukraine. So it's not just a war to gain territory, it's the war that Russia wages against children's rights, and we can't stay silent about that because a country just can't intrude upon other country, violating the rights of children of other countries. And when we're talking about internal violence, because it hasn't disappeared and it's not related to the war state, and it's not related to other countries, it's about violence in institutions. Frequently we think that violence is something very visible and obvious, but in institutional care settings it takes other forms. That's denial of agency, isolation, punitive silence, coercion to express gratitude, humiliation, emotional neglect, and disregard for basic needs. And the Office for Children and Youth of the Ministry of Social Policy that I belong to participated in the monitoring visits to such institutions. We documented violations, but what hurt most if after recording violations, children are left alone with the people who were supposed to protect them and didn't protect them, and the perpetrators were not just left unpunished, they were not even removed from contact with children. And when a child sees that even after public exposure nothing changes, this is secondary violence and a second act of violence. It erodes the very meaning of justice. If a child asked for help once and was not protected, a child may stay silent forever. So I will keep saying that we need to make sure that this silence does not become normalized, and that we have no such cases when children have to survive in a place where they're supposed to live. So what are we doing? Together with young people who have lived in institutional care, we developed a separate document outlining how violence against children institution must be addressed. This document has been shared with all of the relevant government bodies and professionals involved in working with children and youth in care, especially in institutional care. here, and we emphasize very clear, simple, but essential principles. Every report of violence must be considered from the child's perspective. Children must not be treated as passive objects. They should be treated as subjects with their own agency, and the response mechanism must not only record the facts but change the situation, because the trust cannot be restored otherwise. Because when adults automatically put their trust into adults, not into children, we will have repeat cases of violence. When it comes to the government of Ukraine, recently approved a standard program to prevent violence and abuse against children, and the government continues to work on other essential policies with the goal to build an integrated child protection system based on prevention, identification, response, and recovery, working with consequences. And here we work together with you and colleagues from other countries. That's very meaningful and truly required to work out this mechanism that would be effective and efficient for different people and for different institutions, because unfortunately lots of things are interdependent, and this chain could be ruined if unqualified or uninterested institutions or people are performing these actions. What is also important to remember, when a child talks about violence, they risk a lot, because if nothing happens as a result, a child would stay silent and muted. So we can't stop at identifying the problem. We need to have follow-up actions that will be simple, understandable. And for other countries, what's important, even during the full-scale war, Ukraine, owing to the support of international partners such as Lumos organization, EU, USA, UNICEF, and other partners and countries, does its utmost to support the key areas for children's life. This is the child care system, access to education, social services, and support for families and youth. Our experience proves that even under emergency and special conditions, it's possible to invest into safe environment for children, because one case that a child lived through or even saw without the follow-up support leads to the vicious circle and enables the other case of violence. We are ready to share experience. We are ready to learn from the others' experience and to jointly build the environment where children would be truly safe and protected. Thank you for your attention. And I'm ready to answer any questions. Of course, not everything is as great as we'd like to have. And even when children and youth representatives contribute to decision making and are involved in this area, yes, the decision making also takes into account our experience. We try, and we are really grateful to our partners here, that when meeting with our government bodies, they insist and emphasize how important it is to involve us into the decision making. Thank you.
Kirilo, thank you, first of all, so much for all that you are doing on this agenda. It's quite extraordinary, and for sharing some of that with us, giving us a glimpse into the progress that's being made in Ukraine, which may be surprising for some people who are non-experts or non-familiar, that even in that environment, and as you just said, even in emergency conditions, even in a crisis, with the right political will, with the right support, and absolutely, as you've emphasized and articulated, with the involvement of children and young people and those with lived experience in shaping the response, etc. Just how powerful that can be, even in the most difficult of circumstances. Thank you so much for sharing that. We're going to move now to hear from Rebecca Smith, who is the Global Head of Child Protection at Save the Children International. Rebecca and Save the Children have been involved with a framework for action, which was launched at the Bogotá Ministerial Conference on Ending Violence Against Children. It's a framework of action which brings together looking at alternative care and family strengthening. We know they sit within a wider framework of child protection systems. And the framework of action, I believe, has been endorsed by 12 governments, 20 civil society organizations, and 5 UN agencies. And I believe, Becky, you're going to bring this to life for us today.
Great, thank you, Howard. Yes, so we launched this framework for action together with the government from Brazil, Philippines, Poland, and Sweden at the Bogotá Conference, the Ministerial Conference to End Violence Against Children. And I know that our colleagues from Ghana also touched on this. And what we did was we wanted to highlight the areas of a child protection system which needed more work to bring about meaningful change. So we highlighted the policy and legislation, governance and coordination, human and financial resources, a continuum of services needed, and the need for child and community participation. And as you'll see, many of the government speakers today highlighted some of these areas. In terms of care reform, we want to make sure that the laws and policies prevent harm from happening to children in the first place, like our colleagues from the Philippines spoke so meaningfully about, but also that they prevent harm from happening in the first place in all settings. So a ban on corporal punishment in all settings, including schools, residential care facilities, and even within the home. We all have a role to play in setting families up to succeed. And in legislation, that means parental leave or social protection schemes, looking at parenting programming, inclusive disability services, and support to at-risk households. If we're going to end child institutionalization, we need to address the reasons why children go into care in the first place, and we know that that differs country by country. For governance, in the side event in Bogotá, the government of Uganda gave a powerful intervention about the multiple ministries that were needed to coordinate it to end violence against children and strengthen a strong and inclusive child protection system. That includes health, education, justice, and social welfare. But within care reform, we also need to talk with ministries like the Ministry of Religious Affairs and even the ministries of tourism, and also looking at external relationships as well, to make sure that care reform and deinstitutionalization is part of the national action plans to end violence against children. And again, it's exciting to see that that's part of the reform in the Philippines. And Save the Children, our work on public investment in children, we know that a significant portion of the budget, often from the Ministry of Social Affairs, often goes towards residential care facilities. And we need to look at how do we work together to redirect that funding towards ending the institutionalization of children and supporting community-based services, and again, the extended kinship care networks that exist around the world. For the social service workforce, which our colleagues in Ghana mentioned, really thinking about what are the skills and competencies that social workers or those working in a hospital or a school or a police need to know to identify and refer children who are more risk of violence. And also, how do we measure those competencies, recognizing that some of the best social workers in the world don't have a lot of significant professional training, but they have learned on the job and they know how to communicate better with children and families. How can government accreditation systems better reflect the real skills needed of the workforce, which are demonstrated through practice and supervision rather than an academic classroom? Finally, I want to touch on the continuum of services to make sure that children and young people are protected regardless of whether or not they're a refugee or they cross a border, and connecting that to thinking about early detection and intervention services, along with thinking about preventing unnecessary separation and unnecessary placement of children into care. The social service workforce needs to be trained on how to prevent separation and respond in an emergency, including climate-induced disasters. And I know that there's been a lot happening with ASEAN and others in Asia and the Pacific around really embedding the training for social workers on family tracing and reunification, and also thinking about emergency preparedness planning and anticipatory action to prevent separation from happening in the first place, and making sure that governments are ready to respond when there is an emergency to ensure that children are not separated from their families unnecessarily. Finally, we want to make sure that communities and children are actively involved in bringing about real change. There are many care leavers associations, many of those who are on the call today, and some of which I know the Ukrainian delegation has spoken about. They are powerful advocates for the need of care reform and the violence they've received in care settings. They know the kinds of support that's needed, and we need to make sure that children and community members are helping to create the laws and policies needed for change and better respond to their needs at a district, provincial, national, and regional level, as well as creating complaints mechanisms and feedback loops to make sure the workforce is accountable to the children and families in which they serve. We all have a role to end violence against children, and Save the Children looks forward to working together with many of you to bring about meaningful change in the lives of children in all contexts. Thank you.
Becky, thank you so much for that. As with all the speakers, there's so much in there, but I think that locating the conversation we're having today and that broader continuum of services that are so important for children, as well as the range of other issues you touched on, the drivers of why children end up in care, the need to redirect the funding that perpetuates some of that, and of course the criticality of the social care workforce, and much more. It's very rich what's coming out. I just want to note in passing before I introduce our next speaker, do keep an eye on the chat and the Q&A that's coming in. We've had a really good question around mental health, and is there adequate recognition and response to the mental health impact for those who grow up in care? And another one proposing, I think it's one of our earlier speakers, Prince from Ghana, proposing that there be a continental benchmark for Africa on a minimum expected government expenditure for child protection and care services. They're great to see ideas coming out and being proposed as we move through today's event. And just to give everyone a time check, we are about 15 minutes or so away from the end of this event. We have a couple more speakers, and then there'll be a wrap up and a summary of some of the next steps. So without further ado, I'm now going to invite Marisol Blanchard to speak. She is the Senior Advisor on International Relations from the Inter-American Commission on Human Rights. And we've been talking so far, Marisol, about the Global Ministerial Conference, action at the global level, at national level, but of course, regional cooperation also plays a very important role in helping facilitate implementation of national pledges and knowledge sharing. So over to you to speak, I believe, on behalf of the Special Rapporteur on the rights of the child.
Hi, good morning, good evening, good afternoon to everyone. And thank you so much for including the Inter-American Commission on Human Rights. It is very important for us to be part of this dialogue, and we feel very honored. I am representing the Special Rapporteur on the Rights of the Child of the Inter-American Commission. And as some of you might know, the Inter-American Commission on Human Rights is the regional human rights institution for the Americas. We have the Inter-American System on Human Rights that is composed of the Commission and the Court, pretty much as the our sister African system. And the Commission is based in Washington, D.C. The Court is based in Costa Rica. It is composed of 7 members that are elected by the General Assembly. The Court as well has 7 members. And the key mandate is to monitor the human rights situation in the Americas. And we have basically 2 mandates. One is the protection mandate. So we have a petition and case system through which the Commission has analyzed and developed since the very beginning the concept of the rights of the child. And we have incorporated the different jurisprudence from different organisms. So the corpus juris that the Commission has embraced takes into consideration all the decisions of the Committee on the Rights of the Child, also of the European system and of the African system. And in this sense, in 1998, the Commission decided to create the Rapporteur on the Rights of the Child to especially focus on the development of the protection and the development of standards for the protection of children in the Americas specifically. Through the rapporteurship on the rights of the child, the Commission monitors systemic violence and child protection frameworks across the Americas. It promotes compliance with international and inter-American standards, the Convention on the Rights of the Child, the American Declaration, and jurisprudence of the inter-American system. Now, the Commission understands that violence against children is rooted in structural inequality, such as poverty, discrimination, racial or gender bias, and must be addressed comprehensively, as some of the speakers have already addressed. And that child protection systems require reform that is intersectional and rights-based. States are obliged to prevent, investigate, prosecute, and repair all forms of violence against children, including within families, schools, digital spaces, and institutions. And as my colleague from Ukraine has stressed, accountability mechanisms, including reparations and safe alternatives, must be integral. Now, child participation is a policy cornerstone for the Commission. This means that children must be involved meaningfully in decisions affecting them in line with Article 12 of the CRC. The Commission has increasingly included children in hearings, consultations, and thematic processes, a practice we urge all states to replicate. On this line, child protection systems must pivot from reactive models to protective, restorative, and community-based systems. So transition institutional responses towards models of multidisciplinary care, which coordinate legal, medical, and psychosocial support in child-friendly environments. States must strengthen alternative care options, foster care, family reintegration, community care, while eliminating institutionalization. In this regard, the Commission issued a thematic report a few years ago that addresses the progressive need to transition from an institutional system to a family-based care system. And I'll show you the page because it was a drawing by children. I don't know if you can see it. No, you can't see it. Anyway, there you go. It's the right of boys and girls to a family. Alternative care, ending institutionalization in the Americas. In this report, which I can share the link to with all the participants, the Commission analyzes the obligations of states, the rights and the right of the child to a family, and makes recommendations aimed at strengthening the protection of children and adolescents who are without or at risk of losing parental care. Now, the Commission also establishes in this report parameters applicable to alternative care and recommends that states strengthen a process of desinstitutionalization of children who are in these types of establishments. In particular, the Commission in this report emphasizes that separation of children from their family must respond to the application of a special measure of protection issued by competent authority, be legitimate in accordance to the law, adopted with respect to due process guarantees, and must aim at safeguarding the rights of the child. Specifically, the Commission takes note that according to international law, priority forms of alternative care means that the states have to consider the placement in the extended family first, and that if that is not possible, in a foster family. Only as a resource of last resort should authorities consider the admission to a residential care facility that can provide personalized attention in an environment similar to that of a family. So the report issues a series of recommendations to states in order to transition. Now, the Commission is ready to support regional cooperation and international cooperation through expert dialogues, peer learning, exchange of good practices, and capacity building. And we have done so with several states in the Americas. And that's why it is so important for us to have the honor to be here. In terms of what accountability and progress monitoring has meant for the Commission, we have included as effective remedies public tracking of policy implementation, such as budgets, staff training, care quality, regular reporting on child's rights indicators, such as homicide, violence, institutional care. And we have used the different mechanisms of the Commission, such as public hearings, urgent measures of protection, and follow-up to ensure compliance. This forum is a very good opportunity to reaffirm and deepen our steadfast commitment to ending violence against children. The success of child protection systems depends on sustained resource allocation, legal reform, civil society participation, and multi-level cooperation. So with this, I will end it, and thank you very much for inviting and including the Commission.
Thank you so much, Marisol. And I see that Florence has posted in the chat a link to the report, the Commission's report, and it's good to hear also that intention and offer of supporting regional cooperation. So that's fantastic to hear that. Thank you for bringing that to life. We are just a few minutes away from finishing. We have one last but not least speaker expert to hear from. And as I think most of us know, that children with disabilities face increased risks of unnecessary separation from families, of institutionalization, and of violence. And one of the groups for whom the interface between care and protection and violence is at its most acute is children with albinism. These children face a really serious risk of violence, which is often used, sadly, as a rationale for their institutionalization. So I'm delighted that we're now going to hear from Maluka Ann Miti-Drummond, who is the UN independent expert on the enjoyment of rights by persons with albinism. Maluka Ann.
Thank you very much. And thank you everyone for having me. It's great to be involved in this and to be part of the conversation. Children with albinism often get left out of such conversations. And I think it's great to have the opportunity to highlight their specific situation. I joined when Rebecca was speaking, and I sat through her, her presentation, thinking, "Why am I here?" She said it all. So a lot of what I have to say has already been said by Rebecca, but I guess my focus is a lot on children with albinism, and just in case anyone doesn't understand what this has to do with this conversation. Children with albinism, persons with albinism, but children with albinism disproportionately are affected by attacks in a number of African countries. And this is due to wrong beliefs and superstitions that the body parts of persons with albinism can provide some kind of good luck, riches, fortune, if used in ritual practices. So because of this wrong belief, children with albinism often are abducted, mutilated, have limbs cut off, sometimes killed for their body parts. And these attacks are a form of violence that is not always talked about. So the attacks on their own are a form of violence that are not always talked about. And this is violence that we need to also consider when we're talking about violence against children. Violence that is brought about by myths and superstitions and just lots of misunderstandings and the need for education. And how do we tackle this violence? And Rebecca did talk about how we need to ensure we're tackling the violence in the communities, the root causes, the drivers of the violence. In this case, one of them being myths, superstitions, misunderstanding. And so we always talk about the need to demystify albinism, to ensure awareness raising around the attacks around albinism itself and persons with albinism. So awareness raising is one of them, but we also are aware that there are other concerns, there are also other concerns that we find that sometimes children are exposed to violence because of other superstitions. So not necessarily just other stigma and discrimination against them. So not necessarily just the attacks, but then because of stigma and discrimination, families might be abusive towards their families, might want to relinquish the burden of care. And so all this requires a lot of work. Issues that Rebecca mentioned, the whole social protection, continuum of care, all those are applicable here. What we have seen with children with albinism, unfortunately, is that the policies sometimes put in place to prevent violence or to respond to the violence are actually violence themselves. And the violence in this sense is the institutionalization of children with albinism. So we have seen in many cases, for example, this happened in Tanzania where children with albinism were placed in boarding schools. Now, I have to be very careful here. I want to say in this case, when I'm referring to boarding schools, I'm referring to boarding schools that take on the characteristics of institutions. And especially because the children are placed in these boarding schools and they don't have contact with their family, they don't go home during holidays, they end up living there. And we all know what happens when children are institutionalized. And this came out from the Committee on the Rights of the Child that did a mission to Tanzania to look into these boarding schools, and it came out that there was violations of other rights. You know, the children had no adequate standard of living. They were concerned about food. There was concerns about health, and so these are all concerns that come out during this. You know, that the response is actually one that results in violence as well. And so I did a report to the UN General Assembly. Sorry, excuse me, I've got background noise. Sorry about that. I did a report to the UN General Assembly, which looked at children with albinism and the right to life. And basically it looked at the issues of deinstitutionalization, violence against children, and how we prevent these violence against children. So I'd like to refer to that report, but the report also, again, refers to what Rebecca has mentioned, as well as issues of using family-based alternative care methods rather than boarding schools, and ensuring that any placement is temporary with an exit strategy, ensuring that there is connection with the parents, done on a case-by-case basis, taking into account the best interest of the child and not in an institution. So there's a lot more that I can say, but I'm also aware of time. I think, you know, Florence has a link as well to the report on this. And, you know, I'd be happy for people to read this link. Please reach out to me if you have any questions. And I'll be very happy to go further into this and discuss it further. But I'm aware of time, so I'll end there for now.
Malakana, and thank you so much for joining us and for sharing that. And we do have access to that link to further materials, etc. But you know, I don't want to diminish the power of what you just said and the importance of what you just said. And it's really great to end with that. Thank you so much for joining us. We are at time, so in the next 2 or 3 minutes, we're just going to wrap up and share some next steps. So thank you. First of all, to all of our speakers today. I'm not going to list you all by name, but a very big thank you both for joining us to speak, but more than that, for what you and your colleagues and partners and collaborators in your countries or regionally and globally are all doing on these very important agendas of tackling violence against children while strengthening child protection and care reform. Secondly, thank you to everyone who has joined us today. Particularly those who also asked questions and comments, etc. I think there's some really insightful, really challenging questions in the chat, including from people in countries who are not represented on the panel today. And that's, I think, evidence that we need to keep moving this conversation forward. We need to bring in new countries, new partners, and continue to maximize, I think, the leverage, if you like, of what took place in Bogotá and the pledges made there. So I think that's a takeaway for some of us who are involved very closely in all of this. I'm not going to attempt to summarize the rich messages that came out of the conversation today, apart from maybe just 2 or 3 that I've been scribbling away as we go. I mean, one is, I think it's really clear that tackling violence against children, including through the necessary reforms to childcare and protection systems, is both an enduring challenge everywhere, but progress is being made even in some of the most difficult circumstances. And I think through that we have a recognition of the core, and it's the violence of institutionalization of children which unites us in this conversation today. Secondly, I feel today has been a real moment for shared learning, for peer-to-peer exchange, which we must harness, which we must continue. And I think that value of community and of shared experience moving forward together, I certainly have learned today and been inspired. And I hope that you too have been both informed and inspired by some of what you've heard. And I dare say you also have additional questions as well. Thirdly, I just pull out the lived experience bit. I think that came through from a number of speakers, the criticality of listening and involving those with lived experience to make sure that interventions respond to their needs, that services are equipped and tailored around children's experience. And the financial strand came through too, the criticality of the adequate financial resources if we are to respond properly to this challenge. And that includes nationally, but it also includes international cooperations as well. So what happens next? Mainly it's the ongoing implementation of the pledges by countries represented today, by countries who didn't join us today. And we look forward to meeting again soon and hearing again of further progress, but also to celebrating, to sharing what's working, sharing what's not working, and encouraging and jointly working together. There are some milestones ahead, which I think can be good hooks for some of those conversations. We heard from David from the UK government of an imminent launch of a global charter in the months ahead. I think that will be an opportunity, both as a moment, but also as a process ongoing to catalyze the political commitment that we heard about was so important. But more than that, as a menu, if you like, and for action on these agendas. We also in November will have the 1-year anniversary of the ministerial meeting to end violence against children in Bogotá last year, I imagine. I don't know, but looking at Sabine and others, there'll be plans around that. So there are opportunities globally. There'll be other processes at regional level. There'll be national processes too, which I think we can use variously to continue the conversation and make sure, as I say, that we continue to share what's working, be honest about what's not working, honest about where we are in the journey, but continue to move forward as a global community, making national, regional, and local progress. So with that, a very big thank you from me to everyone and the team behind this at WHO, BCN, UNICEF, Lumos Foundation, and others in putting all of this together today. And it's back to Sabine for the last word.
Thank you, Howard. As always, you're such a wonderful moderator. I too very quickly want to thank the governments of Ghana, Kenya, Philippines, UK for your brilliant remarks. Really great expert interventions and survivor interventions. Really appreciate it all. Just as a reminder, we have our next digital dialogue next Wednesday on ending child marriage. You might be realizing we're trying to thread these different topics together. We've heard so much about parent to caregiver support, children with albinism. How can we make sure that those children that are often excluded from these discussions are more included at the next ministerial conference? So we're carefully taking notes of everything you're saying so that these topics are properly addressed. Thank you again to Lumos and to the Better Care Network for your wonderful work, and I wish you all a lovely day or evening or night. Bye-bye.